Hi, you are watching COVID updates on Voice of Canada, and this is Sana Haroon. New York City will become the first major US city to require proof of COVID-19 vaccination for customers and staff at restaurants, gyms, and other indoor businesses as the country enters a new phase of battling the highly contagious Delta variant.
It will require vaccination for workers and customers in indoor dining, in indoor fitness facilities, indoor entertainment facilities. This is going to be a requirement. The only way to patronize these establishments indoors will be if you're vaccinated, at least one dose. The same for folks in terms of work. They'll need at least one dose. This is crucial because we know that this will encourage a lot more vaccination. We've seen it already. We've seen the impact of the mandate we've put in place for city workers already starting to move people to vaccination. We've obviously seen the positive impact of incentive as well. The goal here is to convince everyone that this is the time. If we want to stop the Delta variant, the time is now. And that means getting vaccinated right now. So today I announce a new approach, which we're calling the Key to NYC Pass. The key to New York City. When you hear those words, I want you to imagine the notion that because someone's vaccinated, they can do all the amazing things that are available in this city. This is a miraculous place, literally full of wonders. And if you're vaccinated, all that's going to open up to you. You'll have the key, you can open the door. But if you're unvaccinated, unfortunately, you will not be able to participate in many things. That's the point we're trying to get across. It's time for people to see vaccination as literally necessary to living a good and full and healthy life.
To me, it's the easiest way to go. It keeps us safe. It brings us together again for us to do things together. Like, I think it should be a basic requirement because human beings are very difficult to manage. So the only way to go about this is to make these people understand in a polite way that they need to get the vaccine, and making it a requirement to go to some places, I think is good. And that will help us to bring in other people who are not vaccinated to get the vaccine so that we can get back to normal.
I think that if you want to be vaccinated, you have that right to be vaccinated. You also have the right not to be vaccinated. It should be your personal choice. I personally am vaccinated, but I don't think I have a right to tell anyone else that they should or should not be vaccinated. And it, in my opinion, is the same thing as abortion. So you don't have a right to tell someone whether or not they can or cannot have one. So you shouldn't be able to tell someone whether they should or should not have to get a vaccination.
I think he is 100% right in that one. I mean, we all just have to be secure, you know? Remember, like a year ago, I was scared to come outside, so vaccination is very important.
I think they should show proof of vaccination because I feel like that could help the cases go down, you feel me? Because you don't want to get engaged with somebody that hasn't, you feel me? That's it.
Well, on the one hand, I don't like it, but I do think that the public health is more important than anything else. And whatever we have to do to have our old life back, where we can go everywhere we want to go and do what we want to do, I think we should just...
Canada is still number one in the world for COVID-19 vaccinations, with over 67% of its population now fully vaccinated.
Over the last week, the number of doses being administered daily in Canada has dropped by half, and it's a problem for two reasons. Not only does it mean fewer people are being protected against COVID-19, but it means some doses could go to waste.
No healthcare provider wants to be in the precarious position of having to dispose of what is liquid gold in the vaccines.
And when the vaccines arrive in Canada, they're stored in freezers. The provinces place orders for how many doses they believe they'll need a month ahead of time, and those doses are shipped to doctors' offices, pharmacies, and vaccination centers. But then the clock starts ticking.
Once they're thawed, you really have about 28 days to use those vaccines. And you can't refreeze them or repackage them and put them back in the box and send them elsewhere. They've got to be used.
Dr. Bogosh is part of Ontario's vaccine task force, and he points out there has been far less wastage in the COVID-19 vaccination campaign compared to the seasonal flu. Those soon-to-be expiring doses can be moved across the province to other regions, but it's just too complicated to donate them to developing countries.
If you look at the time to extract, to do the quality assurance, to inspect every single vial to make sure they're not spoiled, and then to ship it, it's going to take longer than a couple of weeks.
While some doses have already gone to waste, the government is making sure the developing world gets vaccines. According to Gavi, the Vaccine Alliance, Canada is fourth in the world when it comes to donating doses of COVID-19 vaccine to the rest of the world, just ahead of Japan. And that's in addition to the hundreds of millions of dollars pledged to purchase vaccines for poorer countries.
Ontario still will not mandate COVID-19 vaccinations for students or staff when returning to school in September. Unlike with other vaccinations currently required in schools, Education Minister Stephen Lecce said on Wednesday.
Good morning, everyone. Thank you for all being here, and I would like to thank the staff at the Robert Catholic High School and the York Catholic District School Board for having myself and my colleague and friend Mr. Lecce here today to make this important announcement. Thank you, Minister, for coming to the Markham Chamber Markham today. And I would also like to recognize Dr. Moore. Yeah, I don't know, you gave me the good news story. You studied at the school, and that was great. And also, York Regional Medical Officer Dr. Reggie is here. And also is Dominic Squilia, Director of Education for York Catholic School, and also other Dominic, the school board trustee also there. Thank you all for being here. As a father, I can't think about anything that's more important than health and safety of my children. I know that parents and teachers are worried and that kids are eager to see their friends again. I'm proud to say that the health and the safety of Ontario children is our government key priority as we reopen the school for in-person learning. Minister Lecce and the Premier are committed to a comprehensive plan to reopen our school and in-person classes. The bottom line is that kids need to be in school. It's essential for their overall well-being and long-term success. If we are going to get students back in their classroom where they belong, we must ensure that our school have a cool and clean learning environment. Mr. Stephen Lecce is going to talk more about what our government is going to do province-wide to improve air quality and needs in the schools. But I'll tell you what's happening right here at St. Robert's School. The current large gymnasium had an exhaust-only ventilation. I'm pleased to report that we are upgrading that system with a new rooftop unit that will provide better quality mechanical ventilation. The investment will help protect Markham students, school staff, and their families from COVID-19. By investing in improved air quality in school, our government is putting hardworking families first. At this time, I would like to turn the floor over to Dr. Kerji, York Regional Medical Officer of Health, who will have more say on this. Thank you. Thank you, MPP Kadapati, and thank you to Minister Lecce and Dr. Moore and Dominic Scalia. I am pleased to join with representatives from the Ontario Government and York Catholic District School Board to share this education investment to help reduce the risk of COVID-19 transmission in our schools. Like many communities around the world, York Region is experiencing the impacts of COVID-19. We have suffered loss and impacts to our mental, physical, and emotional well-being. I have maintained throughout the pandemic that reopening schools is a priority to help support children's learning development and mental health. I am pleased to see the Ontario government's guide to reopening schools. It is a cautious and sensible approach. With good public health measures, contact and case management, and outbreak control, we will see our children prospering in our schools. There is also benefit to the evidence-based approaches being taken to enhance both overall indoor air quality and COVID-19 risk reduction. We must continue to follow all other public health measures outlined in the plan, including screening, physical distancing, wearing a mask, and cohorting students. And lastly, but most importantly, vaccination is key to returning to normal. While the success of the province's vaccination program is promising in providing protection against COVID-19 and its variants, greater vaccination coverage is required across all ages, recognizing Ontario's youngest learners are not currently eligible for a vaccine. I encourage everyone eligible to receive your vaccines to help avoid a resurgence of cases. On a personal note, I recently announced my retirement effective this September.
The World Health Organization is calling for a moratorium on COVID-19 vaccine boosters until at least the end of September.
I understand the concern of all governments to protect their people from the Delta variant. But we cannot and we should not accept countries that have already used most of the global supply of vaccines, using even more of it.
Germany, Israel, and Russia have already made moves to prioritize booster doses instead of donating the shots to nations in greater need. The WHO would like to see every country first get to 10% of their populations vaccinated before starting to administer those boosters. More than 80% of the global COVID-19 vaccine supply has gone to high and upper middle income countries. Experts say vaccine equity is important, but boosters should be discussed on a country-to-country basis.
The gap between high income and low income is both unethical, and it creates an epidemiological risk to all of us.
Israel is a very small country that has an excellent health care delivery system, and even more important than that, an excellent health data system, and has a track record of sharing that really important data with everyone around the world.
As the COVID-19 pandemic continues, the Canadian Medical Association and the Canadian Nurses Association are calling for vaccinations to be mandatory for all healthcare workers in order to help keep the public safe.
If we are going to make good for this winter, we better get on with it now.
The Registered Nurses Association of Ontario was the first to call for mandatory vaccinations for healthcare workers last month. Now, as more organizations join the push across the country, its CEO is not pleased Ontario's Premier won't heed it.
I'm disappointed that the province doesn't have the guts.
So far, no province has made vaccination mandatory. Tuesday, the Canadian Medical Association and the Canadian Nurses Association put out a joint call.
We work in an industry that everyone that needs us is potentially susceptible to picking something up and having poor outcomes.
I think it's always challenging for governments to make these decisions, but I think our job as leaders in healthcare is to sometimes make difficult decisions and lead with science. And I think the science is clear.
Unlike Ontario and Alberta, BC hasn't shut down the idea.
It's important to me that we have all of this nailed down before we go into the fall respiratory season.
As for whether individual employers can act on their own,
there actually is quite a bit of legal basis to say that employers, if need be, can require vaccination.
We know some healthcare workers are vaccine hesitant, but there's a lack of national data about just how many have their shot.
A lot of healthcare workers are marginalized women, so a lot of them have questions on pregnancy, fertility, and these are all valid questions to have, and all it really takes is having this one-on-one discussion.
Sabina Vora-Miller has helped many with questions like that decide to roll up their sleeve. She says the reasons some healthcare workers haven't been vaccinated are varied. It's a complicated issue.
Whether we have these healthcare workers who are working 100 hours per week and just don't have the time to go get vaccinated, or don't have sick time to go get vaccinated, or are worried how are they going to do their job if, they have a sore arm, for instance.
She believes the vaccination rate would climb if there was more education and paid sick days.
Canadian Prime Minister Justin Trudeau said on Thursday that he has asked the Privy Council to look into making COVID-19 vaccinations mandatory for federal employees, as well as possibly requiring them for federally regulated industries.
We have enough vaccines in Canada right now for all eligible Canadians to get vaccinated. That's why there's no more excuses. People who've been waiting because they didn't feel they were a priority should now go and get their first dose and their second dose. Like 80% of all Canadians who've gotten their first dose, and the closing in on 65, 70% in the coming weeks that are getting their second dose. We need to get vaccinated to get through this pandemic, particularly with the real concerns around the Delta variant that we are facing. It is striking hardest, obviously, on under-vaccinated and non-vaccinated people. And it's not just about protecting yourself individually, it's about protecting your community. It's about protecting the kids who are under 12 who can't yet get vaccinated but who desperately want to go back to school in person. It's about protecting educators and parents and frontline workers. It is time for people to get vaccinated. For those who are hesitant, to go and get their first doses and their second doses. That's why I've asked the clerk of the Privy Council, who is responsible for the federal public service, to look at mandatory vaccinations for federal employees. And we're also looking at federally regulated industries to encourage or perhaps even to mandate vaccinations for those industries. It is time that the 80% of Canadians who are doing their duty towards their neighbors, towards their loved ones by getting vaccinated, be able to get back more and more to normal, get back more and more to regular life. For that, those who are hesitant, it's time to get your vaccine. They are safe, they are effective, and we're going to continue following science and the recommendations of NACI and our public health officers when it comes to further boosters. But right now, we know that getting vaccinated with 2 doses of an approved vaccine in Canada is the best way.
Foreign travelers coming to the US could soon be required to show proof of COVID-19 vaccination to gain entry.
As the world opens up to Americans, the U.S. has so far failed to reciprocate, banning entry for many foreign travelers and perpetually extending the closure of its land borders with Canada and Mexico.
We will be ready when it is the right time to consider reopening travel, and that'll be guided, as always, by the science and the public health.
For the first time, the White House has hinted what the future of entry into the U.S. might look like, including a likely requirement that all foreign travelers be vaccinated. Details about what kind of proof would be required and which vaccines would be accepted still have to be decided.
This is acknowledgement that there's really one way out of this pandemic, and it's broad vaccination by the entire world. You really do need to have some sort of minimum standards. testing is not enough.
The explosive spread of the Delta variant in the U.S. has put any plans for loosened travel restrictions on hold for now. There are 60,000 COVID patients in American hospitals. CDC models suggest a continued surge of new cases in the range of 200,000 daily new infections by late August, driven by lagging vaccination rates in many states.
The biggest concern is that the virus will continue to mutate, and it will, and that it could become more deadly.
A vaccine requirement for visitors would land as domestic vaccine mandates ramp up. Los Angeles is the latest U.S. city to consider mandatory vaccination to access gyms, restaurants, and public buildings. New York City announced similar plans this week, all meant to encourage vaccination at home as the U.S. grapples with a resurging virus within its own borders.
Canadians have been told to take the first COVID-19 vaccine they are offered, even if that means getting inoculated with a combination of different shots.
Ironically, I guess selfishly, I took it because I really thought it was the thing that would get me back to normal fastest.
But because Brent Matheson got a vaccine combo, AstraZeneca and Pfizer, he can't take the 3 cruises he signed up for. Cruise lines, along with at least one Caribbean destination, aren't accepting mixers and matchers. If nothing changes, Matheson is out all the time spent planning, several $1,000s for the cruises and up to $7,000 in flight credits.
It is stressful. I honestly have had sleepless nights over this.
He's not alone. There are at least 3.6 million Canadians who mixed vaccines, plus thousands more who got the Covishield version of AstraZeneca, not currently accepted by some European countries.
It's devastating. I think we finally feel like there's this green light and there's a glimmer of hope. And then again, we're told, just wait a second, it's not that simple.
3.6 million doesn't even include some Quebecers, but that province is already offering a 3rd dose to fix the problem.
Will get sorted out. It's only sort of a matter of time.
Infectious diseases physician Alex Wong thinks more provinces will consider a 3rd shot.
We're fortunate enough, obviously, in Canada and most of the rest of sort of the first world has a relative abundance of mRNA vaccine right now. So 2 doses of mRNA vaccine probably are going to end up being sort of the standard.
The Canadian government stresses it's working with other jurisdictions to fix things, while Canada's top doctors warn we don't yet know the potential health impacts of taking 3 full doses.
It should be based on the science and not sort of, I think, on convenience factors or, based on sort of a policy, be it other countries.
If somebody offered me another Pfizer, I would take it.
Frustrating for so many people who took the first shots available as they were told.
As debate grows over the need to administer 3rd COVID-19 vaccine doses, immune-compromised individuals are expressing their concerns.
Living with 2 illnesses, Christy Dickinson takes a weekly immunosuppressant. And although she's fully vaccinated against COVID-19, her condition means she's constantly concerned about her level of protection.
It's just an additional layer of anxiety, I think, for most immunocompromised people.
Early research shows the most vulnerable among the vaccinated may see a significant drop in antibodies sooner than the general public. Marie-Josée Lafleur, who has Crohn's and also takes immunosuppressants, believes a booster shot could help.
By September, in my case, it's like I never got vaccinated because I won't have any protection from the double vaccination.
But Canada's top doctor reaffirms there isn't enough data to show boosters are needed now.
Our focus is, as we've said in our opening remarks, getting people their 1st and 2nd dose for everyone who's eligible.
Bioethicist Carrie Bowman says this is the right move.
The way to deal with this incredible pandemic is to deal with it globally. And, again, focusing on boosters is moving us away from that goal.
Still, public health professor Barry Pegas wants to see some countries move forward with 3rd doses.
And they'll be getting data from that over the next weeks to months. I think that is critically important to informing the decision globally about 3rd doses.
First-time mom Kay Niedermeyer, who received vaccine priority because her son is immunocompromised, says while she worries about a 4th wave, she'll wait for any top-up.
Right now, I'm more concerned about sharing the vaccines with the rest of the world.
Dickinson agrees, but says it means her health is in others' hands.
I don't have the immune system to protect myself against this disease just on myself.
Hoping for a more lasting solution to this global pandemic.
Nationwide infections have reached a 6-month high, while almost every state is now in the red zone, meaning the level of community transmission of the virus is now at its highest.
The scenes are reminiscent of a time the U.S. thought it might never return to. Daily infections are topping 100,000. Community spread is now substantial to high everywhere, including all 11 border states.
It is, as we've said, a pandemic and an outbreak of the unvaccinated.
This latest wave has taken a devastating toll on the U.S. South, including Florida. Testing sites are once again bumper to bumper as the state breaks records for cases. There are so many people in hospital, elective surgeries are being postponed, with most public health measures to slow the spread, like masking and capacity limits, no longer in place.
I think we ought to use every public health tool we can when people are dying.
That becomes difficult in a place like Florida, where politics plays a heavy hand. The state's governor has threatened to cut off funding if any school implements a mask mandate. But troubling signs lie ahead. Arkansas and Georgia, which returned to class last week, have at least 1,300 students already in quarantine. Most aren't eligible for the vaccine.
If you have a lot of disease in the community, you may get disease in the school. The whole point is to have disease not transmitted in the school.
While large gatherings are helping to drive this surge, it's the unvaccinated who are the vector of Wave 4, as daily deaths spike to around 500, sparking discussions amongst EU nations that it might be time to shelve inbound American travel. The bloc lifted a ban in June as the U.S. appeared to be on a course of control. Non-essential travel could once again be cut off, a move that would see Canada one of the few nations welcoming Americans in as the country struggles to keep the virus out.
Concerns continue to grow over the coming school year as a fourth wave of COVID-19 looms and the highly transmissible Delta variant hits more unvaccinated Canadians.
When Desiree McHugh first noticed mysterious marks on her teenage daughter last March, she thought it was some kind of rash.
We reached out to the doctor. He said it wasn't rashes, it's bruising. So just random bruising showing up all over her arms, her chest, her neck, her shoulders, her face.
Just one of several strange symptoms the 15-year-old has been struggling with for months after a COVID-19 infection last fall.
It's an evolving topic, and we're still really trying to drill down on quantifying exactly what is the risk of long COVID and what symptoms do children manifest.
Dr. Stephen Friedman has been studying COVID-19's effect on kids for the last year and a half. He says while by and large children are far less likely to experience serious disease, it's far from impossible.
We do still see some children, uncommonly and infrequently, who do become severely unwell, sometimes during the acute illness, but almost even sometimes more commonly afterwards when they develop this inflammatory syndrome called multisystem inflammatory syndrome of children, which can result in more critical illness.
There have been more than 40 cases of Miss C in Alberta alone. 7-year-old Hunter McConnell became ill following a COVID infection last May.
We spent 3 days in the ICU, a couple days on the other unit. He's still being followed by cardiology, infectious disease.
While rare, doctors expect to see more cases of Miss C and long COVID in kids through the Delta-fueled fourth wave. Parts of the U.S. are already seeing more children in hospital compared to previous waves.
It's a little difficult to say if the increased number of children that we're seeing being admitted with complications of COVID is due to something about Delta intrinsically, or is it due simply to the fact that Delta is such a contagious virus that we're now seeing more cases.
It's why both doctors support masks in school this fall, particularly for children still ineligible for vaccine. The risk may be rare, but families like the McHughs know it's not impossible.
Keep watching COVID updates on Voice of Canada. For further updates, visit our website voiceofcanada.tv.